It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. GNAT, NAGRAT, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers -NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.
As you did with Teachers Fund, we want to know from you how to move from here and make this place a global center. Thank you very much. So we are ready for you, Daddy. Thank you.
President of Conference, distinguished delegates to the conference, Happy New Year to all of you. As you look around, I'm reminded of what they say in my village. They say, Kwachi adefe, yedisika neye. Kwachi adefe. It means if you had entered here 5, 10 years ago, it would have been bush, forest. But vision and money can transform everything. And let me congratulate the leadership of NAT. They have always been exemplary of all the unions in Ghana. Going back to the powerful women chairman, Madam Baden. Going back to the first one, Osei Tutu the first, T.A. Bediakon. Now we have Osei Tutu the second, Thomas Musa. Irene Adanusa and Paul Osei Mensah. These are people who work tirelessly and sacrifice for the teachers. For example, yesterday, about 6:30, I was watering my garden. There was a knock at the gate. I opened, and there was the General Secretary. Oh, he's coming to remind me about today's meeting. The most difficult people to organize are teachers, because every teacher is a pocket lawyer. And all your general secretaries have been inflicted with suspicion, insults, but they've led exemplary. I remember Paul Osei Mensah. He's not a giant, small. When we're talking about how to set up the Teachers Fund, Paul Osei Mensah said, look, for the management of the fund and the investments that we make, we want you to employ people and pay them according to their market, not the small salaries we pay teachers. Of course, it was difficult for the other teachers to accept this. And I remember one of the regional chairmen, a big, tall person, kept interrupting Paul Mensah. After about an hour, Paul turned to him and said, if you continue like that, I'm going to be very angry with you. And the man sat down quietly. I said, wow, this is power and leadership. Please support your leadership. They work for you, they sacrifice for you. What we are trying to do with this center is to make it globally second to none, the best. Let me tell you a story that Eddie told me when he was driving me from Kumasi to Accra. At first, I was frightened. He drives like a maniac. But I realized he's very careful and cautious. And a distance that normally takes about 4 or 5 hours. By the time I read about 3 hours, we were already home. And he said, a Nigerian client had tried to get cancer treatment in India, it didn't work. He had money. Germany, it didn't work. US, it didn't work. Then he came here. The PET scan machine that they have was able to detect that his prostate cancer was not just only in the prostate, but also in the hips. They treated him, and he left cured. Within the next 5 years, we want you as teachers to support this foundation. I know it is difficult when teachers are contributing 5 cedis a month for 5 people, yourself, spouse, and dependents. That's 1 cedi a month for cancer. On the average, a cancer treatment will cost 80,000 Ghana cedis. So that is not much. But your strength, as I conveyed to Paul Mensah when we first met, was that the men are very bad in domestic things. They don't know about a broom. You know, the broom we used in the villages, made from palm sticks. When you take one, you can break it. If you add even 5 together, it's difficult to break. That's what your 260,000 members, when you join together, support your leadership, there's nothing in this world that you cannot achieve. The leadership you have had, if we had had the same leadership in Ghana, Ghana would be like Singapore by now. So the vision that Eddie Manson and his team have is that within the next 5 years, we are going to have the cancer center built fully, diagnostic and treatment. But the diagnostic is going to become the priority number 1. Because once you diagnose and you have early detection, then you minimize the expensive treatment. So that will be our vision. And also, there are certain related diseases that cancer brings. It attacks your organs. So a cardiothoracic unit will be added. And of course, kidney dialysis will also be added. This will all initially be centered here. But later on, after 5 years, when we hope you would have supported your leadership to support the center financially to grow, then they have in mind in your 10 regions of Ghana, wherever you have a facility, some of the diagnostic services will be there so that you don't have to travel all the way here for diagnostic. So for the next 5 years, I'm pleading with you. Support your leadership and let's move this thing forward. And in 10 years' time, when you are moving out and new teachers are coming, they will praise you for what you've done. Now, the leadership is being very modest. I know that the teachers, GNAT, Ghana National Association of Teachers, and the Teachers Fund is rich, but teachers are poor. And this is what we remind all managers of the fund and their facilities to bear in mind. When you are managing Teachers Fund, always remember the money is coming from very poor people. We are going to be asking His Excellency the President of the Republic and his resetting agenda to make sure that in the salary structure of the public service, teachers equivalent are given a minimum of 20% premium over the others. Because countries that do well in this world are countries which attract the best brains into teaching, into engineering. Because it is the human brain, human capital, that is used for development. The monkeys were here before us, sitting on the gold, but they were not rich. We have to use our coconut to do it. And it's only you, teachers, who can do that. And when a teacher reaches out a hand to a child, that child has a good future. So what we are going to do is that we want you to please consider, distinguished delegates, to support your leadership. And let's move this 5 cedi contribution to 30 cedis. $30 I've been fighting with the General Secretary that when we say 30 cedis, it means for 5 of you, it's 6 cedis a month for cancer. And, you know, if you are unfortunate enough to have cancer, and now cancer is coming out very quickly. It affects children and all of us. 2.5% of us, all of us here, will sooner than later catch cancer. So please consider, I know it is a lot, but think of it as buying maybe how many sachets of water and putting it aside, just in case, God forbid, one of you attract cancer. What we are going to do within this period, we are engaged with actuarial scientists to help us so that we communicate with the insurance company which you own to build a mutual health fund. That will mean that they will be insuring teachers for health. And that insurance company, if we were to put it on them now, would destroy your investment. But if we wait and develop this place within the next 5 years, build up the mutual insurance fund for the teachers, then they can insure you and reinsure with a reinsurance company, both here and outside, so that when the demands come and they pay, then they can get somebody to supplement them. This is the way we are looking for financing this center and beginning a globally second-to-none cancer treatment center with allied services related to cancer. That is renal, kidney, and then thoracic, the heart. So let me wish you a happy new year, good health, happiness, and a fulfilling year. And let us focus at this conference and resolving this problem of financing this center to become something that all teachers will be proud of, that you own this. And next time your leaders are talking to your colleagues in Nigeria, Sierra Leone, Gambia, and the West Coast, and probably even to the unions outside, they can say, come and see what we have done here. And continue to insult your general secretaries and your executives, but know that they always work for your interest and they sacrifice for you, your insults notwithstanding. Thank you, Mr. President.
PET scan facility, first of its kind in West Africa. Unfortunately, I wish we could go down here, but because we are operating and then there's escape of radiation, we are unable to go there. It can hurt you. So even for people like me, we are not supposed to go there. It's only those who work there that can go there. But let me just take you on a brief tour up there. So this is the first of its kind in West Africa. So this one gives us very clear images of the patient's body. It helps us know where cancer cells are. We produce radioisotopes down there. Radioisotopes are generally sugar. And you know cancer cells attract sugar. So once they are injected in your body in the application that we saw where we're coming in, after an hour we put the patient on the machine, we scan you, and then the machine is able to tell us from the images wherever there is a cancer tumor. It makes it easy for the patients, the doctors to treat the patient, and also gives us better treatment outcomes. We normally scan a minimum of 2 for a patient, 1 before treatment, 1 after treatment, to enable us to know whether the treatment was successful before we started or it's not successful. We have to go into a second line treatment. So that's for a normal patient. But for other patients, we need more than 2, 3, 4, depending on what the treatment outcomes are. And a scan costs 16,000 Ghana cedis. So imagine that a patient is supposed to have 2. That's the 2,000. That's just scan image before the cancer patient gets treated. So that is the PET scan machine for you. As we go out there, I'll show you. Is it different from what is here? That's a CT scan. But this is a PET and CT. This one is a CT scan, and behind it is the PET. So we have 2 different images, PET and CT. So the doctors can compare the 2, and then they are able to come out with treatment decisions and treatment outcomes. So that is what we have for you. Thank you so much.
Good afternoon. I am here with Madam Hamdia Ridwan, a delegate from the Ashanti region. She's been here for the very first time at the SGMC Cancer Center, and would like to hear from her what her experiences and her observations are so far.
Thank you very much, Auntie. Thank you for the opportunity once again. In fact, I've been a teacher for 4 years now, and God being so good, I've had the privilege to be part of the delegates for this year election. This is my first time at the SGMC Center, and today I'll call it the saddest day of my life because we've been coming across cancer issue only on TV or on news. But me being here today, it reminded me of a colleague teacher I stay with. In fact, when I entered one of the surgical rooms, I cried. I really cried. I really shed tears because I said to myself that if I be a victim or if I become a cancer patient, from the background I'm coming from, give me the opportunity to have access to, this facility so that I can be cured or something. Okay. It's so sad. So me being a teacher and paying a cancer fund of 5 students, from what I've learned and what I've seen today and from the experience I've had with a colleague patient with cancer, I'll plead and beg my colleague teachers that for the sake of others, if not you, it can even be me or the other opponents tomorrow, I'll plead and say we should increase our fund at least, if not for perfect amount, but at least we should increase it from the current payments
a significant amount.
Yes,
right?
to a reasonable amount.
Okay. All right. You were talking about a colleague of yours.
Yeah.
Why would you relate, or how were you able to relate to the colleague's condition and then you coming inside here, seeing the other patients there?
Honestly, I think cancer is so deadly, and because of the stigmatization, people hide it.
Okay.
I stay with her. She's a neighbor and she's a colleague teacher, but not in the same school or the same district.
Okay.
I was with her all of a sudden for the past 6 months. I don't see her. We call, we don't reach her. So people in the area or the society were saying that she has traveled to abroad, not knowing that she has been sick and she has been in this facility for 6 months.
Wow. You don't mean it?
I'm telling you, for 6 good months.
Wow. And how was it like before she gets in here? Obviously she's a teacher, so how did she get the information, or how did she get the referral to this place? Was it a smooth transition for her?
Yes, because she being a teacher, she had the knowledge, or she had an idea, or she knew that we teachers or not, we pay some amount to the facility, or we've been hearing cancer fund, but because it hasn't come closer to us, we didn't. But my colleague that we are talking about, because she fell a victim, and when she fell a victim, she was doing the herbal medicine and stuff. We used to see her healthy, but not knowing that she was dying inside. So I think she did a lot of herbs, and at the end of the day, through her CS and the directors, she had a smooth transition to this place. And as I'm talking to you now, she's responding to treatment, but it's so sad and pathetic, to be honest with you.
Wow. It means that just like we have heard today, and just like the leaders have been saying or have said so far, people are really benefiting from the center.
People are really benefiting. This colleague that I'm talking about is from a different region, but from my district itself, this year 6 teachers died of cancer.
Wow.
Because they stood home for the thing to be worse before they were referred here. Some of them survived, but 6 teachers died in my district this year. Yes.
So let me ask, what would have been your stance if you didn't come for this conference and then you were at home and you heard that maybe they said they're going to increase the funds to maybe a certain amount above what you have been paid? How would you have felt and how would you have reacted?
Thank you very much for this question. Honestly, the colleague that I'm saying, if I didn't even went closer to her, I wouldn't have known this was the sickness she's suffering from, And if I wouldn't have been here, when I was coming, my colleagues told me, when you come from the conference and you have the opportunity to, bring your view, please tell them that we are not paying for the cancer fund again, because how many teachers suffer from cancer?
Oh, okay.
Yes, that was what they told me. But after what I saw today, I said to myself that the moment we
that view has changed, right?
That view and the perception, and I'm going to talk to my people.
Wow.
To have a change of mind.
Wow. That's touching and interesting to hear at the same time. I believe that this is how sometimes life experiences can change our perceptions about certain things. Thank you very much for speaking to us this afternoon.
Okay, so my name is Promise, radiation therapist. So when I say radiation therapist, we use radiation to do therapy on basically cancer cells. Okay. Okay, so I'm saying that radiation therapy, okay, is the use of radiation to treat cancer cells. Then again, not only cancer cells, we can use it to treat keloids, you can use it to, if you are bleeding too much, you can also use radiation to do that. Now, before you come in, this is what we call the CT machine. I'm sure most of you have heard about it, computer tomography. What it does is to diagnose exactly where the tumor is located. So I'm sure most of you have done CT scan, chest x-rays, normal x-rays. So that one, you only see your bones, okay? But I don't see your organs, your stomach, your bladder, rectum, you can't see that one. But with this machine, you're able to see that. So normally the patient lies down over here, and then the machine is off now, so. And then you move the patient through this space over here. As the patient moves, there's this X-ray machine which moves around within this equipment. Okay, as it moves, it scans the whole body. It scans the whole body. So if the area of interest is the pelvis, we only scan the pelvic area. As much as we want to use radiation over here, we also make sure we don't expose your entire body to unnecessary radiation. So depending on what the doctor wants to see, if he wants to see whether there's any spread, in that case we'll be scanning the whole body, just to make sure you don't have any spread. So when the patient comes, the first procedure is to do the diagnostics. First of all, you want to see if there's any spread, where the tumor is located and all that. So we do the scan. Once we are done, then the doctor is able to contour. We call something contouring. He decides where the radiation should go. We don't just decide that, oh, it's a prostate cancer, so let me just direct the beam over here. He has to make sure he knows where the rectum is. He knows where so that's the purpose of this machine. Okay. Do you have any questions? Okay.
What's the effect of the radiation that you don't want to
What's the effect of
the radiation on the body that you don't want to expose the other parts of the body?
Okay, so radiation can also cause cancer. Radiation can also cause cancer. So when you are using it, make sure you are using it in quantities that are justified. You don't just expose the patient and say, oh, I'm doing, So you have to make sure the patient is safe after the procedure. Okay. Yeah, you can. Okay, so we don't stand here during the exposure. We go behind the screen. And then we are able to monitor the patient through that. The radiation we are producing over here is not too much. If I say it's not too much, it's more than the one you do on the chest x-ray. But for therapeutic purposes, this one relatively is lower. It's just like the one in your house, electricity in your house and the pylons. The one on the pylons, if you touch it, you're out. The one in your house, by the grace of God, you can survive it. So that's the difference between the kind of x-rays produced over here. Okay. 15 minutes, you should be done. But if you are scanning the whole body, it should take more, about 30 minutes. Yeah. So we'll go to the next area. We'll be going to three areas.
That one we can ask you.
It depends. It depends on the site. Somebody is coming. They do 3 parts. So each of them, it could cost one pack will cost about 500 cedis for this one. For this one, it's radioactive, so you go in this direction. Go behind. Okay, so this is the brachytherapy machine. It's used for gynecological cases. As it is now, it's giving out radiation. Okay. As it is now, it's giving out. That's why I've told you to move. Any part of the body can get cancer, apart from the hair. Okay, your head, everywhere, vulva, vagina, cervix, the uterus, and the ovaries. Those are the gynecological area we are talking about. Now, if the tumor is very, very small, that's where this one comes in. If the tumor is very, very small. If it is big, that one, there's something called external beam radiotherapy. That's what we're going afterwards. when we do that, if it's big, we do that one first, and then when it shrinks, then you come and continue with this. If it is very early, then you don't need that one. You can just start with this one. This one, what they do is they put the radiation inside the vagina, okay? So if the tumor is around the cervix, they will pass it through the vagina, and then they place it very close to the tumor, and then they're able to irradiate. Now the patient lies down over here. As you can see, open the legs, they will put the knee over here, and the doctor will sit over here. There's this tube we have, this tube you see over here, okay? It's connected to the machine. The radiation source is also very small, so it is passed through the tube, and then it goes to wherever the doctor wants it to be located. Now, after they put it inside, they would want to scan. There's something called applicators, which are placed inside the vagina. That's where these tubes are connected, okay? Now, if they scan, they will scan to see whether the radiation source is at the right place. That's where we go to where we just came from, the city. We will have to scan to see whether it is exactly where we want it to be. Now, if we are sure it is, then we just start the whole process. It's a computerized process. Then again, we have cameras to monitor the patient. No worker stays here. The control room is just at the next door. The walls are very, very thick, just to make sure everybody is safe. The public is safe. Your relatives you come with, they are safe. After the treatment, you are also safe. There's no radiation in your body again. It's not like you are walking out of this place with radiation. So that's basically how it works.
I welcome you back once again. I am here with Madam Cynthia Derry from the Upper West region. She's a cancer survivor and also a beneficiary of the SGMC Cancer Center. She's here to share her story with us, a very passionate one, and I believe we'll all pick a thing or two from what she has to say. Over to you, Madam.
Thank you very much, Madam. Okay, so like my sister said, my name is Cynthia Derry. I'm from Upper West region, Ward District NAT. So somewhere 2022, September to be precise, I was diagnosed of breast cancer. So immediately I was referred to the SGMC. Then honestly, when I came, the treatment is top-notch. They took very good care of me. I've done surgery.
Let me come in first.
Okay.
So right from the diagnosis,
yes.
How did you, or how were you able to get to the center? You are not a member, that you have already said it, but how was the transition from the diagnostic stage to the center? How was it like?
Okay, so when I was diagnosed, the doctor himself, it's like he had been referring people here. So he already knew about here. But I still had to contact my district secretary.
Okay.
Yes, so he gave me the backing. And I gave me the things that I would need. He told me to bring my pay slip and then a Ghana card when I'm coming. So when I came, those were the documents they took from me. A pay slip and a Ghana card, just to be sure that you are actually the person and that you are a NAT member. So those were the things they took from me at the receptionist. Then later on, they processed everything and they started with the treatment. It didn't take long.
How has the treatment phase been like? And how long has it lasted?
Oh, the treatment hasn't been easy, honestly. So when I came, they had to do some other tests. Mostly they had to do some background tests to be sure that your heart and other sensitive organs are in good condition to take the treatment. So after that, I was booked for surgery. Then they did the surgery. For the surgery, after the surgery that they now did my chemotherapy. So the chemotherapy, I had about 16 cycles of chemotherapy.
Wow.
So they do, and then as they are doing, they are assessing to see your improvement. So it's not a fixed cycle. Everybody and the number of cycles.
So if I may ask, was the surgery and the chemotherapy all done here at the SGMC?
Yes, the surgery was done. They have a theater. They have a theater here where they admit, and then the following day they do the surgery, and then you stay there. They monitor you for up to a week before you are discharged. And then when you are discharged, you will be coming back for dressing. They want to be sure that there is no infection around where they have done the surgery, because if there is infection, the treatment will take longer time, because they will have to treat the infection again before they continue with the treatment. So this is the same place I came for dressing and they monitored me to be sure that the breast surgery was completely healed. Before they started with the chemotherapy. Yes.
That's nice. How was your life like during the stage of the sickness and then after or during the treatment at the SGMC Center?
In terms of how they handled me, I would say that is first class.
Okay.
Here, when you come, the patient is their priority.
Okay.
They take very good care of you. So they make sure you don't lack anything. But for my personal experience in that condition, honestly, it wasn't easy. Because the name cancer alone is enough to send somebody to the early grave. Yes, so it wasn't easy. But with family and friends, motivation, I just accepted that yes, it has come. Let's look for the solution. And I'm grateful to NAT for being there for me. But for NAT, probably I wouldn't have been standing here today. That's the truth. Because look at the number of chemotherapy cycles I've done. Then I also did 45 cycles of radiotherapy.
Wow.
So imagine just multiply by the amount and then see. And even the surgery too, the cost is not easy. So assuming this NAT facility wasn't there, probably an ordinary Ghanaian teacher without family support and other things, how will I be able to survive? Okay. So I'm very grateful to NAT for this facility. That's why I'm here. I want to urge members to do the contribution. The 30 cedis for me is even small. Left onto me alone, 200 Ghana, but because it's we are coming together with many people to contribute, probably 50 cedis is not bad. When you are not in the condition, you understand what I'm saying. I am a beneficiary, I've been there, and I know that 50 Ghana cedis will not take anything away from it, but it is going to save somebody's life, like it has saved my life as I am standing here. So I believe that if we all come out to contribute, because when we went around, I think the managing director told us the cost of the machines and other things, and their medicines are very effective. They are imported. Okay. So we have to make sure that the center keeps running with our little contributions. Okay. Because here, where we have reached, if we don't pull out together, it means that we'll be at a standstill. So let's sacrifice at least the small, how we started is small. Let's continue, let's not give up. Let's look at the lives that we are going to touch, because don't even pray to benefit from it. Don't at all, because it's not a good experience. As I'm standing here, if you had seen me in early 2023, you wouldn't have recognized me. This is my elder sister standing here.
Wow.
My whole hair, the whole hair fell off. Oh. My eyebrows, nails, my skin became very dark. Yes, some people that came to visit me couldn't come again because they couldn't stand the way I was looking. Because they know me, who I am. For them to come and see you lying helpless, it's not easy. But with NAT support, I am here to thank NAT. Thank you so much, NAT. I am grateful. Thank you. Thank you. Thank you.
Thank you very much, Madam Cynthia, for sharing your lifetime experience with us.
Thank you.
This is so touching, and we pray for total healing and recovery. Amen. So that you be a living testimony to testify of the goodness of what NAT has done and then what you are doing through the SGMC Cancer Center. Thank you very much.
It's a pleasure. It's a pleasure. Thank you.
So we had it from Madam Cynthia Derry. Thank you very much for staying with us.
But the pain that you are in and all that, we can manage it. So you are no more. So we use two machines for our planning. We use the MRI, so we have an MRI here. It's because it's magnetic, that's why we don't want to go, because you know, magnet pulls. So anyone with a magnet, your card, your MasterCard, anything, you can have a problem there. So we won't go in there, okay? And then we have a CT machine over there. So basically, if the patient comes, if it's a bony structure, for example, the bone, or that, we do a CT. If it's a soft tissue like the brain, you do an MRI. Okay.
It can be prostate, cervical, breast, endometrial, head and neck, colorectal, or any other cancer. They have no place here. Why? Because SGMC Cancer Center treats all solid tumors no matter the stage of the disease. We use advanced technology like radiotherapy, brachytherapy, and chemotherapy for our treatment. Locate us behind Lakeside Estate, Community 8, Katamanso, or call us today on 0201 409 403 or 0262 253-328 for inquiries and booking, and your cancer burden will be a thing of the past. GNAT, NAGRAT, ECG staff, as well as their spouses and children below 18 years do not have to pay to receive treatment at SGMC. SGMC Cancer Center, taking away the burden of cancer.
Like and follow us on Facebook, Ghana National Association of Teachers -NAT. Follow us on Instagram, NAT_HQ. Subscribe and watch our videos on YouTube, Ghana Teachers TV. Follow us on X, Twitter at NAT Official. Read more about NAT on www.ghanateachers.com or email us through info@ghanateachers.com.